Hi,
Hello.
how are you?
Good. Are you the only person who's working more now than less?
I think all like bloggers and YouTubers are working a lot more now.
Yeah, I've taken my days from 16 hours to like 5, and
That's,
it's
I mean, enjoy it. When else are you gonna get this time?
yeah, it drives me. I get a little anxious because I sit around and I'm used to doing something, and so my body feels like I'm failing at something. I,
No, I
I
mean, I'm looking at that pool and I'm so jealous. I miss LA.
I'm going in it today, so finally we get to use it.
Hmm.
What, are you in the city or where are you?
I'm a little bit outside of New York City. I was there, but I obviously left because it was dangerous.
Yeah,
So
you don't want to stay there. My
yeah,
friends who work in the hospitals there are not having a very fun time. So they're getting
you have
called
friends that are
from
working in the hospital.
yeah, I did my training in New York. So I was in New York for 7 years. So all my friends are there.
Wow.
And they're I talk to them, a bunch of them every day. I haven't talked to a lot of them because they're so busy, but they're yeah, they're all getting called in to run different units than they're used to. There's like ortho guys doing like
No way. Yeah, I've heard. I mean,
doing
they're
like
basically calling all medical, like any medical professional to like step forward, right? Although,
yeah.
as a pharmacist, I don't really know what I would do in there. So,
I don't know what I would do. I don't
right.
remember anything. I tell everybody I'm like a fluff doctor now. So I'm like a fluffy doctor. I'm very good at like what I do, but I have no idea about like real medicine anymore, except for like the vague things I can remember. Yeah. So for everybody knows about you, so the because I'll introduce you to my people who are wondering.
Sure.
So Mona is and was a pharmacist, but became more of a vlogger over the past several years, and now you have like a humongous following on YouTube, and I like it a lot because the things that I've seen from you, it's from somebody with like a scientific mind. So they're very, I think, intelligent options, and it's a lot of holistic medicine, which is great. I trained a lot in holistic therapies in med school, and then
Oh wow.
also in residency too. In residency, I had my mentor in medical school was he was a family practitioner who practiced holistic therapy, holistic medicine, and like acupuncture. And then when I started in residency, I had one of my attendings. I was an ENT originally before facial plastics, and she was big into, and that's in New York at Columbia, and she was big into doing different holistic treatments for ENT stuff. So we were
Oh really?
yeah, so I've always been big into it, and there's a huge role for it. Even in my practice now, we try to do a lot of that stuff, and obviously I'm not as up to date with it as you are, which is why I want everybody to follow you that I know, because everything that
Thank
I
you.
saw, it's like it's a blatant, like obviously I would approve of. It's very intelligent stuff,
Thank you
whereas
so much.
it is though, and like I'm very cautious. Sometimes I follow people and I'm like, oh god, it's fucking voodoo. I'm like the stuff they say, but
Yeah.
everything I've seen you say from acne treatments to jade rollers to lymphatic massage, to the makeup issues, travel tips you have, I've seen all this
Ooh,
stuff.
you really researched. I love it. You
Yeah,
did
well, I
some.
got curious. My cousin's like, you got to go see Mona Van. You got to see what she's doing. And so I went and I started looking through, and I'm like, oh shit, this is entertaining. So I watched a ton of it. I even saw you cooking with your mom some lubia pula.
Oh, I mean, that recipe I love.
Yeah,
That video was one of my more popular ones because everyone loved that.
yeah, and I think your accent is the only one that's funnier than mine because I have a horrible accent, of course.
My Farsi accent.
Yeah,
My lack of Farsi accent, you mean?
yeah. Mine is terrible. People always wonder, like, oh, why don't you speak Farsi in your consults? I'm like, I sound like a 5-year-old. It's not going to make me sound very
I don't even
intelligent.
I used to speak fluently, but then I completely forgot. So I've always been trying to like relearn, but it's just so hard. Like I don't pick up languages easily. Like it's not something that comes. Some people are like learn multiple languages, it just never. So I've
Yeah,
tried, but kind of given up
yeah.
on it, to be honest.
I throw in more like Spanish now than Farsi, and it just falls in. And if I travel,
I'm sure like
I
your
get
clientele, like
confused.
it could probably both like even like advantage of Spanish and Farsi.
Yeah, yeah. In New York, it was all Spanish because I was at Columbia and Cornell. Columbia was all Spanish speaking. It was
Hmm.
Dominican, Puerto Rican, because you're in Dominican Heights, Washington Heights. And then
Yep.
back at Cornell, it became all kind of more highty-tighty whitey. It's like
Yeah. Yeah.
different population on the Upper East Side. So I wanted to ask you some things for the benefit of my own patients kind of watch this stuff a lot, and I think it's super educational if they just go through everything that you have. But some of the cool things that you were talking about was acne treatments,
Yes.
and the things that I would like you to just say your favorite acne treatments for active acne, for resolved acne, so for actually like trying to get the rolling pitting and all that better. And then if you don't forget at the end of this to tell me like what you think are kind of the snake oil stuff, like the not so real, can't believe they try to sell that stuff, because you do have that pharmacy background and you've seen, I'm sure, a
Right.
lot of this like bullshit stuff that they try to sell.
Of course. I'd say for active acne, I think it's all depending on what would work best for you, but some kind of combination of like benzoyl peroxide, salicylic acid, or sulfur. Um, One thing I want to say too, as much as I love the holistic route, I try to always let people know I'm very much not against medicine when needed. I think I should start sharing more of this, but I definitely am more of an integrative approach where like natural if you can, and then if it doesn't work, I don't think there's any shame in like going to Western medicine.
Yeah.
So in terms of like over the counter stuff, those three ingredients are just kind of like tried and true. I think when you go into like lactic acid and glycolic, I know those are used, I think, overall for like clogging your pores and like giving you great skin texture. But I feel like for spot treatment, those three. So I always tell everyone the most important thing to do is to look on the back of the product, because you've seen it. The same brand name can be used numerous times, like Tylenol cold and flu, Tylenol this,
Right.
and they all have different combinations. So you just want to look for those three ingredients, like salicylic acid, benzoyl peroxide, and then I don't think sulfur is as common, but it's worked really well for acne for a lot of people. So I would say those. Um,
Have you used azelaic acid like they do for rosacea as well, for
for
just acidifying,
discoloration,
for just acidifying the skin to make
no,
it like
actually.
a
You
bit of
know,
a
I
hostile
didn't
environment?
azelaic acid get is it legal in the US?
Yeah. You still
Wasn't
have
there a point, or was there a certain percentage that wasn't available? Because I remember I was going to get it in
maybe.
Canada or something.
Oh yeah, maybe percentage wise, I think they're at like 5% azelaic or azeloyal. You could do azeloyal, which is like a powder form too.
Okay.
And the whole idea is just to make the skin acidic, so you have a little bit of a more hostile environment for bacteria and and yeast to like grow on.
Oh,
Um,
interesting.
which is really nice, for using benzoyl peroxide, and then sometimes you add this for the rosacea base. It seems to help a little bit.
I was
Um,
thinking for like hyperpigmentation, because I know like I've been battling that for years, and that was one thing that one of my dermatologists brought to my attention.
oh, with azelaic.
Yeah, but it was years
Okay.
ago, and it always stuck in my head, but I never ended up using it.
Oh, nice. Yeah, for hyperpigmentation, I've actually gone a little more natural because the hydroquinone's a little harsh.
I've tried
So
everything. I
yeah,
mean, tell me your tips, because I would love to know.
well, we've gone through mixes of kojic acid instead of hydroquinone, or using kojic
I actually
temporarily.
haven't. I think Kojic is the one thing I have. I've used hydroquinone, I've used glycolic, I've used retinol, I've done
Yeah,
like lasers, peels, but I haven't used Kojic.
yeah. So we like kojic. It works a little better if you have Definage or Retin A, something that'll give you a little bit of like a deeper penetration with it, because kojic's more mild than hydroquinone, but then doesn't cause all the irritation of hydroquinone. So you just have to use it for longer and be super religious about the sun blocking. And then sometimes there are blends of essential oils that help, but not everybody likes oils. So um, I tell everybody, try it, see if it works for your skin. If it doesn't work for your skin, then switch to something else. But the blends tend to work a little bit in calming it at the same time. But it takes probably like
Interesting.
2, 3, 4 months, as opposed to like hydroquinone, which if it's beneficial to somebody, you see it in like a month.
I'm not gonna lie, hydroquinone hasn't done anything for me.
Yeah,
I'm like one of the only
so
people that
some
I
people,
think it hasn't worked on.
yeah, if you have an irritated base, it'll just irritate you more. So
Hmm.
it's yeah, some people just get red and inflamed. But sorry to cut you off with
No, that's okay. The next
the
thing you were
acne stuff.
asking was it was about like pitted at like a textured acne, like pitted
Yeah,
scars.
yeah,
I
exactly.
always tell people no topical is going to work for that. You've got to get a laser. Like maybe I've never seen IPL. I know maybe IPL could work for that. I've never actually used
Mm.
it, but I feel like that's when you have to go into like an ablative kind of laser. Microneedling might help a little bit, but like I personally, like, I love the idea of microneedling and I love it for prevention, but I
Mhm.
definitely didn't see like drastic results. And I even did it with PRP, but
Yeah.
I know that it's good long term. So I personally think it has to be something a little more intense. I don't know what your thoughts are.
Yeah, yeah, I agree. For the deeper the acne, the more intense you have to go, unfortunately, because it's not real skin anymore. So
Mhm.
it's kind of fake skin, like stretch marks. Stretch marks aren't real skin where you'd say it has all the original layers of the epidermis and the dermis. You get this atrophic skin. So it's like little hammocks of skin everywhere. So no matter what you do to it, it's not going to react like normal skin. So if you laser normal skin, it'll form collagen and elastin and then hyaluronic acid in the dermis. Whereas acne skin is kind of missing a lot of the dermis. So you can laser it all you want. It's not going to respond like your body normally would. Um, but there still is something to be said for shrinking the areas. So what I try to do, the most aggressive I'll get on somebody, legitimately, I have to do a facelift. And I do because it stretches out their skin. They have
Wow. Oh, so that it doesn't have like the deep hole.
right,
Like,
and it distends it. They have less skin, less accordion effect of the skin, and then when you laser it, the laser shows its effect more. And it's an aggressive move to make, but it's the biggest improvements I've seen are from that, and then like radio frequency and a laser. The deep chemical peels are nice, but they're super aggressive, and I don't like, even for acne patients who are just trying to get through something, I don't like giving them huge downtime.
mhm.
And surgery is a faster downtime than these like
Wait,
deep
really?
penile peels. Yeah, yeah.
Wait, can
It,
we just pause and talk about a like facelift? In my like thoughts was always like this super intense thing. Like there's less downtime on a facelift than
than a deep chemical peel. Yeah.
which could take like 10 days or something, 14
So,
days or whatever.
so well, a deep chemical peel, if we're talking about like phenol or the deep blue peels, not the regular ones, the ones that you're doing multiple layers, they
Mhm.
take usually about, I'd say 2-3 weeks to be remotely normal, and then probably another month to calm down. So you're looking at about a 2 month kind of recovery with those things.
Wow, I guess I've
For the
never gotten that one that deep. I mean,
No, those
mine
are
I
those are
don't get that
aggressive.
much. Okay.
Yeah, 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 those
Okay.
are aggressive. But that's the most aggressive. If it's somebody, who's just doing basic treatments, I've used nano fat with PRP and it tends to work better than PRP. And then the microneedling, the way I look at it is it's a maintenance therapy, like getting a facial. So, you get a facial, you look good for like a month or two, or well, less than that. But either way, with
Right.
microneedling stimulates hydration in your skin. So it'll get your skin fluffier or puffier for maybe a month, maybe 2 months, and then you just have to repeat it. As far as like long-term collagen deposition, you're not getting a lot of it. You're getting maybe like tiny little amounts. So it's
Is that
mainly like,
true?
yeah. So it's mainly that hydrational effect. It's
Now,
different.
do you think doing microneedling every 2 months is there any damage to that to like
No,
your
no.
skin if it's light enough?
Yeah, yeah, it's light enough. It's rare. It's not impossible. Some people do form fibrosis from any kind of stimulation to their skin, but that's
Mhm.
uncommon. Most people would respond positively to it.
Okay.
So you do it as like a maintenance thing. And the PRP, most people don't even do proper PRP though. They're doing plasma. So they'll take 10 cc's of blood and they take 5 out of it, and that's just plasma.
Ugh,
That's like
the
your
you mean the vampire facial when it's
y-
actually red?
yeah,
I
yeah.
tell
So
people that I'm like, that's such a marketing scam because I'm like, if you come out there red, you're actually getting a less intense facial because you're not getting concentrated plasma. You're just getting diluted,
yeah, yeah,
blood and
yeah.
plasma. Totally. I
Exactly.
literally just talked about that in a podcast this morning. Like I said the exact same thing.
Oh, really? And then
So
some
yeah.
people are actually trying to microneedle the blood back in, and we think the blood has nutrients. Realistically, blood is very inflammatory. It likes to, feed the skin oxygen, not leak into it. So, um, you get hemosiderin deposition, you get more inflammation. It's better to
You can
have,
microneedle the plasma in,
yeah,
right?
but some
Yeah.
people microneedle the blood back in.
Yeah, that's crazy.
It's
That's
crazy. Yeah, it makes no
yeah,
sense. So yeah,
makes
so
no
when we do PRP, we do like 100 cc's of plasma of blood, and we take out 10, and that's real PRP, and it'll enhance healing to whatever you do. So let's say like PRP or microneedling doesn't get a big improvement, it'll get a little bit more of an improvement. Or radio frequency gives you this much, it'll give you a little bit more. It draws in the immune system more. So I have seen that work, and especially for like scars and stuff. For somebody with super healthy skin, it's like a facial. It's like like a fancy facial.
What about do you ever inject the plate like PRP?
Yeah,
I know some people kind of inject it, which it'll make you swollen for like 2 days, then go. It's almost like temporary filler,
yeah, yeah.
right?
So I do inject it. I inject it right under the dermis.
Hmm.
So but I do some kind of stimulation to it. If you just inject the PRP, it's not going to do much because there's not much damage for the body to heal. You have to
So
incite
both, like
some kind of,
microneedling and injection.
yeah, or radio
Okay.
frequency or something. The one thing that I've seen that makes a difference on everybody, even without like major trauma, but still some microneedling, is the nano fat. So we take,
Is that like stem cell, you mean?
it's called stem cell
Technically?
fat, but yeah, but they're adipose derived stem cells, which just means they're like progenitor cells, growth cells. So we take fat, we turn it into a liquid, we extract the liquid, mix it with PRP, and inject that. And that actually has a lot of different signaling factors than PRP does alone. And you see a
Totally. That's
much
the
bigger
best.
difference. Yeah.
Do you get it from the back?
I get it from wherever is easy. So,
I went to a stem cell conference like 2 years ago,
mhm,
and ever since I've been wanting to get like stem cells, but then I know like I mean they were really teaching about like joint pain and like using it
right.
like, in a different way, but I'm always like, where am I going to go? Like, can you just walk into your office and get like the fat injected out like that? Like, is that like an outpatient thing?
Yeah, yeah. So I have people come in. I do it for hair too. So they just lay on their back, you numb up their stomach, extract a little fat, and you use that. And so those are adipose-derived stem cells, and some of the joint doctors use that. Most joint doctors use PRP, and some use some bone marrow. So they're actually drill into your hip, and they'll
That's what
take
I think
some bone marrow
I read
aspirate
too.
out,
Yeah,
which is
yeah.
like,
I mean, he was like,
it's
it was
probably a little
in front of all of
unpleasant.
us, but it looked intense.
Yeah, but I love that stuff, and the joint guys are using it too. And I've been using it a lot for like burn scars and things like that. For acne, it's nice because it puts whatever you do, like the laser, it makes it laser on crack, like just a little bit better,
Yep.
from what it was. It's not magic, but it's nice, and I've seen it work really well for like hypertrophic scars, what people would call keloids and that kind of stuff.
Okay.
Um, so let me ask you about the acne and the skin treatments, and
Yeah.
I hope you don't mind saying just mildly negative things, but what have you seen that you think is just like fake and that people should stay away from? Because that's what I try to do all day. Is I'm just shaking my head all day, and I learned what SMH stands for. I didn't know what SMH.
You just learned
Yeah, people keep
you're with
doing
it
it.
now.
Yeah, because I always thought it was like shit my pants, and I'm like, why are they shitting their pants? That's a,
SMA. Wait, but
like I
then it's
wouldn't.
not even a P.
Yeah,
It's
yeah,
an
I
A.
wouldn't read it. And I'm like, why do they keep saying shit my pants?
Oh my God. There's
um,
like a hot girl writing SMH and you're like reading it like
yeah, I'm like, it didn't work out.
that.
So,
Um,
so what do you think are kind of the snake oil stuff?
in terms of like just anything wellness or just like
No, skin, like acne
skin.
and pores mainly, that people are always selling, and they're selling a
Oh
lot
God.
of, and you just
Okay.
shake your head at.
Any product that says it's going to shrink your pores will not shrink your pores. There's
Wait,
no way to shrink your pores. I do think that, correct me if I'm wrong, doesn't the PicoSure laser kind of actually shrink down the size of your pores? Like
it
that's the
can,
laser.
yeah.
I know I actually did 3 sessions of it like 2 years ago trying to help with hyperpigmentation, and I remember like my pores were invisible like when I saw it, and I thought I read that it could, but there's just no product. They might reduce the appearance, but I hate when people think that's actually going to happen.
Yeah, yeah, I agree. I tell everybody, if there were a cream to diminish pores, like that, that person would own the world. They'd be like billionaires,
Totally.
richer than Bill Gates, richer than anybody. But it just it doesn't exist.
It's like an enlargement pill. You're like, really? Like
Yeah, yeah, exactly.
you're $29.99. Like I think everyone would do
but I trust Ron Jeremy.
this.
And what about like under eye things? What have you found that actually would make the skin look any better or brighter? And then what's
So
fake?
I have like a whole thing on under eyes. I actually did a whole YouTube video on it because I think that people treat it, have to figure out the cause to treat it correctly. Because there's so many different things that could be causing like under eye darkness. Like sometimes if you have allergies and you have like puffy eyes, it can look like you have dark circles. So let's say you have chronic allergies and you go get filler, like that's not going to help you, or some people might have discoloration, like it could be hyperpigmentation, and like they might think that they need to go use like cosmetic filler or something where that's not going to work. I think filler's great if when done correctly. If you actually have a loss of volume, like that can cause dark circles, but there's so many different things that can cause it. And then for some people, when it's genetic, like no matter what cream they use, I don't really see it working. I think the two ingredients for eye cream that would be the best are vitamin C and retinol, because I think, to my understanding, those are the two ingredients that boost collagen the most. of anything you can get for topical. I can't imagine if you have a loss of volume, it's going to make a massive difference. I think it's a
Right.
preventative thing and it can help. Those two ingredients also really help brighten. So they kind of are like a double whammy where it's like if it's a discoloration or if it's like a little bit of loss of volume, they can kind of help plump and brighten. But besides that, I mean, hyaluronic acid obviously hydrates. So it gives it like an instant plumping effect, but it's not going to be like an actual long-term thing.
Yeah, yeah. So I think those are good too. The vitamin C, I've seen it act as the gentlest kind of peel, and it gives a kind of glow to the skin.
Kind of immediately too, right? I feel like whenever I apply it every morning, I'm like, oh, my skin looks great right now. Like right away.
Yeah, so it's good as a base. You put that on first, you let it soak in, and then you can put whatever you want on top of that.
Yeah.
The retinol, it's great for kind of skin turnover everywhere. And classically, dermatologists would tell you not to use it around the eye or around the nose here. But legitimately, when it's sensitive for some people, but most people actually get away with it. So
you know what? I have a family friend who was just use a retinol. I was like going through all of her skincare with her, and I think she's in her 60s, and she tried like a retinol eye cream, and she 2 days in a row, she's like, it's giving me a headache, and I'm like, okay, stop using it. So that's why it's like irritating her. Yeah,
but for the people who tolerate it, it's better than anything because retinols decrease the skin turnover time. So instead of 28 days of skin shedding, you have like 3 days, and it just keeps refreshing. So you're refreshing that top layer of skin faster.
And that's okay to do it faster, like indefinitely. There's nothing
you do it, and most people I know would do it every 3 or 4 days because it just kind of keeps working. And then some patients are like super sensitive to that, so they end up using either Elastin or Definage, which work differently. And I've seen pretty positive reviews about them, not 100%, but people love Definage because I don't know how.
I'm admitting it. What is Definage? I don't know.
So Definage, it's a cream that's based on something called defensins. That's why it's called Definage. So defensins, they're part of the base of the hair follicles, or this, the pilosebaceous units in your skin. And this cream is supposed to go, this is the science of it. Never believe the science because it's usually bullshit, but it's the science of it is that it goes down, links onto those and redirects them from, instead of forming hair, to form new skin.
Okay, so what do you mean don't believe the mechanism of action?
Yeah, it's not always
because it's like in lab in vitro versus like on a human study.
Yeah, and okay. Also, they'll say it works 100% of the time, and then you go do it and it works like 60% of the time. But I have personally a very good experience with Definage, so I do like it a lot, and it tends to get a similar, not as strong effect as retinol, but similar without the inflammation.
Okay.
So
it's funny like a nice because thing. I like retinol a lot. I have no reaction to it, and I've kind of been contemplating. People will ask me too, it's better to get like a retinoic acid or get a retinol. My answer is usually if you're going, so for anyone listening, like the prescription version of retinol, which you need, which is stronger. It's more on if it doesn't irritate your skin, then it's fine. But I think long-term retinol will give you the same result. It's just like a more mild, like slower onset. Or do you think that retinoic acid is just going to give you better results because it's stronger?
I think for the face, maybe a little stronger and better, but for the eye, more delicate is nice. So it is nice to use that. And then within the retin-As of the 0.025, 0.05, and 0.1, they have clinically the same effect for almost everybody. So I usually tell everybody just use the weaker one anyways, because it's going to give you the same effect of skin turnover, because you don't want to have dry skin all the time either. That's like,
and you could use if like the gel is too strong, you could go to the cream. Like there's different options, or like use it every other night. Like there's different ways to go about it.
Yeah, so you don't want it to be where like somebody touches your face and you start peeling like a snake, and it's like you look like moist and nice when nobody touches it, but the second they touch it, it starts peeling.
Second you put makeup on.
Yeah, exactly. It starts caking.
$1 Middle Eastern soap that works magic. I thought they were going to say Cepheid Av. I'm like, that's not you use all over your body. That stuff's amazing.
Oh, I haven't used it.
It's do you know what it is?
No.
It looks like this white, it almost looks like a clay. And it's just like you peel off a piece of it and like use it in the shower, and it kind of just like exfoliates.
Oh, my mom used to use that.
Yeah. It's, I mean, every Persian mom likes
yeah. Yeah, I know what that is. I'm super simple on like skincare myself because if I do anything, like my skin, it doesn't react. The second I start doing something to it, it'll start breaking out.
Like, so you don't use like a crazy regimen.
No, I can't even like if I wash my face with soap, like actually go like rinse with soap, I'll start breaking out. But if I just shower and then wash myself normally and let things just run over me, I'm fine.
I swear men like have it so much easier because they don't break out as much, they don't get as much hyperpigmentation. Like I mean maybe it's because women just like focus on it more, but it's always
Yeah.
because I mean I'm big on products but very nourishing. Like I don't use a lot of harsh, like everything is either really hydrating or like different hyaluronic acid serum and vitamin C serum, and like I'll use like an EGF or like a stem cell serum or something, but bigger
Yeah.
on that than moisturizers.
Yeah. And I like, I don't know what your full regimen is, but I like whatever you're doing because it's not makeup filled face. You see like natural glowing skin. And I try to explain that to my patients who come in and they're like, oh, my skin's so bad. And they cake on all this makeup. And I try to explain to them, I'm like, I'd rather see a little pigment damaged glowing skin than caked over makeup
Totally.
skin. And I
I
have to
think a
draw
lot.
them. Yeah.
You go ahead. You have to what?
Well, I have to draw them away from using these powder based, like caked on foundations to say, okay, well, maybe ease off, try like a tinted moisturizer, ease off, use
Right.
a little, bronzer. And they're like, what do you mean?
The
What's
only
that?
time I do like a full face of makeup is I'm like filming YouTube, or obviously if I'm like going out for the night, but like I just can't, like I don't want to ruin it because even when I have it on, you can just like feel it on your skin. So like if I'm home and doing things, I'm like I just can't. Like the more you do that, the better obviously your skin will be. I also think that sometimes when you like layer on the powders, it just looks worse. It
Yeah.
almost like, it doesn't give you that like fresh like skin look.
Yeah. You lose the glow. If you don't have the glow or the brilliance or the radiance on the skin, it looks kind of dead.
Um, Someone said, what's a good tinted moisturizer? I really like Juice Beauty CC cream. They have it's an SPF 30. It's zinc oxide 20. I'm psycho about sunscreen, so this one is
I
zinc
read
oxide
that.
20%. It's amazing. It's like the best. I won't use anything under zinc 20. It's just not going to go on my face, and it has no white residue, and it gives like a really nice glow. It's Juice Beauty, and if you layer it like 1 to 2 times, or even like put it under your foundation as like a light base, it gives a really nice like glowy coverage. That's a really good one for like CC cream slash makeup slash sunscreen.
Yeah. So everybody knows the zinc oxide ones are like the classic, uh, like lifeguard tower, white pasty
White.
stuff. Yeah. But they work the best. They're the least irritating. The newer ones, which I think everybody's gone back to using those.
Well, now everyone knows the other ones are the ones that go on really clear, like are chemical based. And also most people don't know they take 15 minutes to kick in. So if you just slap it on your face and then go out in the sun, like they don't even work right away. You have to wait 15 minutes. And if you have hyperpigmentation, they can actually make your skin worse because the way they reflect the UV rays off is through like a kind of a heated reaction, and heat can exacerbate it. So there's just so many reasons it's not great, but I don't want my face to be like white and chalky either. So that product, zero white. Like it's actually really incredible. It's really good.
Nice. What's it called again?
If you go to my Instagram under products I love, it's one of my highlights. I have 3 of them on there that are like I'm working on even a blog post of them, but they have swipe ups to all of them where you can just screenshot them and look them up. But it's Juice Beauty CC cream. It's a tinted one. If you want, like it gives like for girls like a really nice natural glow. They also have one that's called Juice Beauty Sport. That's zinc 20 that is white, but if you rub it in, completely goes away. And it actually gives you like a dewy glow. Like it's really nice. So even though it looks like it go on thick, it's not.
Nice. Yeah. So I saw you have an Instagram video from
On this, on sunscreen.
yeah, and you said that you're
Yeah, I
disclosing about
forgot I have an
sunscreen.
IGTV. I'm super passionate with this topic because there are a few amazing products that exist out there, and like the chemical ones just aren't it.
Yeah, I agree 100%. 100%. So for the under eye stuff, what do you think is like the fake stuff that you've seen? I the main ones that I think about is everybody says, "Oh my God, I got this eye serum with stem cells," and I like look at it and it's like apple stem cells or like, and I'm like, you realize what that means? They just ground up a seed and they like put it in there. It doesn't really.
Stem cell sounds so high tech, doesn't it?
It does.
unless you're getting human stem cells, or like for anyone who is having a baby, make sure you bank their stem cells. Like I wish, I knew that. So if you're getting like actual human stem cells, it's way more powerful. But yeah, stem cells from a plant. Unfortunately, I try to go super clean when it comes to skincare, but I have found that like it's just some of the actives don't work as well. Like when it comes to like, yeah, like fruit stem cells or whatever. So I kind of go like 80-20 on it. Like I love SkinCeuticals. They're not
Hmm.
the cleanest, but they're not the worst. And
Yeah.
like their CE ferulic is amazing. Their hyaluronic acid's amazing. So like you have to kind of go back and forth. But I think with eye creams, I guess one of the biggest things is to just not believe what the label says,
Never believe what the label
because
said.
sometimes when I was like, I go through people's products with them and like try to help them, and it's like brightening, wrinkle reducer, and I'm like looking at the back and there's like not one act, you know what I mean? Like I don't see a vitamin C in there, and I'm like, where, like the regulations just don't really, they are kind of non-existent for the cover. So I would just try to always think of like an ingredient that you want in there, which people might not know, but you have to just watch content, read about, educate yourself.
Yeah. Watch your content. You've got a lot. It's good.
I explain a lot.
Yeah.
I think vitamin C, I think retinol if you can handle it, and then vitamin C if you can't, because I've never found vitamin C to be irritating under my eyes.
Yeah. And what's nice, and I mean, it's realistic about your content, is you've had a lot of time to spend on this, where a lot of dermatologists, this is what they've been doing for years, but they haven't sat there with the ability to play with so many things. And so, I feel like you've had like a lot of exposure to it. So the recommendations you're giving people, it's a lot more broad based. Like there's a lot more options, and
it's very like I try to base it on what have I learned, but then also what do I like. It's always like a good mix of like personal versus like scientific.
Yeah, and what about just so for under eyes and puffiness around the eyes? I've always advised people. Sometimes it's because you have poor lymphatic drainage, you have water retention in the face. It could be because of fillers, could be because of fat you had, it could be just genetic that you've always had it. And if that's the case, you kind of fall outside of the normal realm of what's making the eye dark, because there's the hollowing, the accordion effect, the pigmentation, and that you could see through the central part of the skin. The skin gets thinner as you get more medial. There's those reasons, which are classic, and then there is the water retention in the face. So what do you, I have my own way of describing to people, but what do you tell people to do if there's somebody who's just getting puffy in the mornings, or they're retaining fluid in the face?
I think a little bit of morning swelling is a little bit normal. Like sometimes it will, if it doesn't go away and it's like really puffy, a few things. Number one, like if you're eating a lot of salt, like that's just one of the biggest ones. Like, salt makes you retain water. So if you're eating canned foods, like pre-frozen meals, soups usually are really high in sodium. I would watch that and see if that helps at all. And then one of the best things is just either jade rolling or gua sha, pronounced gua sha. So these are different, like just ancient remedies, tools you can use to help boost lymphatic drainage. So we have, our blood circulation system, then we have our lymphatic system, and it's a different kind of circulation. It's how we rid toxins. So the way you can kind of help your lymphatic system flow is literally sometimes just like if anyone's ever gotten a lymphatic massage, it's very gentle. It's just like light strokes. You don't have to press really hard, and you're almost just kind of boosting the flow to go. And sometimes it has water retention. I think one good tip is before you do any kind of lymphatic, let's say you're using the gua sha tool or the jade roller, it's good to activate like the lymphatic system. So there's like one thing you can do where you just like take oils and like lightly rub from your ears here, or there's like some pulsing you can do right here, but that kind of almost like opens up the gateway so that when you get the flow going, it can help. And I mean, there's so many cool videos online to see like a before and after where it looks like saggy or lumpy, and then you just like get rid of that fluid and it can like tighten things right up.
Yeah, so gua sha and jade rollers, so people know they're super cheap. You can get them like anywhere. These are just stones. And the jade rollers, they're having like this size, they have them that size, and the gua sha is just like a stone that's like rounded on one end, kind of. It's like whitish. But how do you refrigerate them or heat them, or do you have a preference?
I like to keep the jade roller in the refrigerator or freezer, and it is so nice in the morning.
It feels better. It feels better.
Oh, it like wakes you right up. It's amazing in the morning, and it's not too like abrasive when you put it on. But you know, that ice, almost like ice, will take swelling down. So sometimes that cold can take down puffiness too, and it feels nicer. So if you can do that, that's amazing. Some people even keep like just like ice rollers and will use them on their face a little bit.
Yeah.
But yeah, you can keep it in the fridge or freezer too.
Yeah. Some people put it in the freezer, and then just, if you're ever using the steel ones, just make sure you don't leave it on one place, because you can get a freezer burn from keeping it on
Oh,
if
that's
they
a
use
good
the
point.
steel
That's a
ones.
good
Yeah.
point.
Yeah. So I've had people come in with like redness for like 3-4 weeks from that. And so everybody knows why this is so important. The way the body works is we have arteries and we have veins, and if our faces and our skin, it's like a big sponge, like SpongeBob. And then you have these little tubes running through it that leak out fluid, and then they reabsorb fluid. So the way that they reabsorb is partly through the arteries and veins, but mainly through the lymphatics, which are these tubes that take the fluid back to your heart. So they have different pathways that they drain. And that's really the secret with lymphatic massage, is learning the pathways, or going to, like, you can go to a therapist to teach you even, or just watch them. Do you have any on your YouTube stuff? Like the
I have
patterns
one
of
video, I
drainage?
actually do. I have one video on YouTube and on Instagram. I'm not sure that I go over like the exact pattern of it, but if I don't, I mean, there's so many videos that show you. And you can
Yeah.
follow the passageway of it. It's pretty simple. You know, you have to watch it a few times, but you could even do a video and like, you know, do it along with them, pause it. There's a lot of great stuff you can find.
Yeah. And if you've got a friend who likes doing this, it's nice to have somebody do it on you. You can do it on each other, actually. And
Oh,
so, yeah, I have people who go through surgery and their friend has gone through like a facelift or a lip lift or something with me, and they've learned how to do lymphatic massage. So they lay their friend down and they do it for them. And
that's so nice. What a good
yeah,
friend.
yeah. So they do that. And it's really great after surgery, because after surgery, you've impaired all the lymphatics, and it takes a year for them to grow back even like 80-90%. So it's really nice when they start doing it. They look better at like probably 1 to 2 weeks, 3 weeks faster than they would have otherwise.
Wow, that's incredible.
Yeah.
Someone
So
asked how to clean them. I literally clean mine with soap and water. Just
yeah, you don't need to do
before I
much.
use it. You don't have to
Soap,
do much.
water, and then you throw it back in the fridge.
Yep.
Yeah, and you can buy it easily on Amazon, like 3 of them for $15. It's like,
Oh yeah. I mean, and of course, like, you know, when it was used years ago, they said like the jade stone is supposed to bring about prosperity, and like, so you could get a rose quartz roller, you could get a jade roller. It depends on if you really want to go like that spiritual with it. But if you just want the tool, you could find one for $10, like $15, like easy.
Yeah. So let's see, with a pharmacist background in you, what do you say about, and this is like my friend's mom was texting me the other day over, I think like 20 texts, telling me how she takes all these vitamins, and her son, which is my friend, takes all these vitamins, and asking me like, what do they do? And most of them, I told her, you're going to pee them out, because she has like a very well-rounded diet. She's not deficient of anything, no dietary problems, nothing. What have you found is actually useful in the vitamin realm?
I'm really big
Or supplements?
on, I hate when people take supplements unless they know they're deficient. I think it's like a waste of money. You don't know if you're taking too much of something that you don't need. I think a micronutrient panel is so important. It goes one step beyond just a regular blood test. So a regular blood test tests like what's in your blood, whereas a micronutrient panel really checks like what your cells are absorbing from your blood. So what you're really getting and truly like what your levels are. And I think going from there and then deciding what your supplement should be, you know, there's so many places that offer this now, and it is a little bit more. It takes like 6 tubes of blood, I believe, to do it. You have to like really hydrate. Yeah, the first time I did it, I couldn't even get all the blood. I had to come back.
Just getting lightheaded.
It just no more blood would come out. Like it literally just stopped. So it's definitely a little more money, and I can empathize with that. But I think that you're just going to waste more money on vitamins that you don't need, and it's just. And you don't have to do it that often, like, you know, once a year or something, or once every 6 months, like just see how things, depending on what you're deficient in. I know for me, like, you know, I eat a vegan diet, and I would think that like I would be deficient in like B12, and that my omegas would be perfect because I eat flax, like I mean, my omegas have always been low. Like, turns out I got like all my genetic testing done, but I just don't I don't have the gene to like convert plant-based omegas. So I have to take like a krill oil supplement. And you never know what kind of deficiency you have. My B12 is completely fine, but my omegas are low. And like, you wouldn't think that on a vegan diet. So I just think like it's so important to get your levels checked and then go from there.
Yeah, I think especially if you're going to commit to taking like lifelong supplements, because she was taking like 20 supplements because
Oh
she
my
thought it
God.
was.
And for who was it? Was it just like the random, like the pharmacy tech might have told her, like, who knows?
Yeah, they're like, I take this for my joints, I take this vitamin C for this, that, uh, like every supplement imaginable. And when I looked through all of them, I said, I think the only thing here that might be beneficial to you out of the 200 that you listed is maybe turmeric, because it's like it's anti-inflammatory and can actually benefit you a little bit.
Right.
And maybe the biotin, because your hair and your nails, I've seen like a visible response from it when you know it
Right.
looks a little
Most
shiny.
people don't see, oftentimes people that are taking vitamins too don't even necessarily see like a benefit. They're just taking them because they think they're, I always encourage people too. I know it's more work, but like take a notebook, like write down how you feel before, like every day, just like how's your energy, like give yourself a little like scale rating of like 1 to 10 so you can actually see if something's working, or else like you're just trying everything and you don't even know what the results are going to be.
Yeah, I agree for sure. The one place where I don't know how it works on people is probiotics. And probiotics, you ingest it, it probably denatures a lot of it as it's going, but seems to be beneficial for some people, especially if some people who have been like taking antibiotics in the past and they upset their flora. Because some people think antibiotics are like vitamins and they think
Oh
it's like
God.
it's
Who?
healing you. There still people think this and they're like,
Yeah.
oh, I need a Z-Pack to feel better. And I
People and
try
their
to
Z-Packs, I swear. I'm like, you
fucking
don't need a
Z-Pack.
Z-Pack. Like, stop it.
It's destroying their floras.
Hmm.
So, I mean, do you take a probiotic, or do you tell people, or just if they have any kind of issue? What do you think about it?
It's interesting because I like there's so much conflicting data on it, and I
Yeah.
have so many other healthcare professionals that like doctors, like GI doctors and nutritionists that are brilliant that I have completely differing opinions on. Like some were like they've been very debunked and some were like no they haven't. I've tried 2 different probiotics in my life like for like a long time and neither of them helped my digestion issues whatsoever. Like I saw no benefit. So from personal experience, it's why I've never recommended one. Like I won't ever recommend something unless I try like it works for me.
Hmm.
Um, but it's kind of one of those like 50-50 things. Like I definitely think it hit like a marketing, like like everyone just went crazy over them, and everyone like had, even when I used to work at the pharmacy, and like people wanted to come get probiotics just because they saw it on TV and they thought it was good for you. But I personally have never seen a benefit from probiotics.
Yeah, and I think yeah, there is a role for it, but for most people who are just taking it, I don't know what it's doing for them if they have a normal gut flora.
You
The
can literally do a stool test and check like what kind of
flora,
bacteria you have. Yeah, check your flora and then you can match it. But then there's also differing opinions on that where some people are like, well, the bacteria in your stool isn't the same as the bacteria in your gut. Like it's not always going to match up. So I've gotten
okay.
such differing opinions on it.
Yeah. So I guess listen to the GI doctor, whatever they say.
Yeah, I would just say go with your doctor. I always wish I could have an answer that was easier, but I'm just going to be honest. If I
Yeah.
don't know something, I'm not going to say I do.
Well, the most contradictory thing that I've seen, I'd say funny, but it's not good to laugh at people. So the most contradictory thing I've seen is when somebody is obsessively taking probiotics and then they go do enemas, and like they'll do a juice diet and then an enema, and they'll like clean everything out, which is the harshest thing you could ever do for your gut that's like sitting and so calm and peaceful, and then you go just like throw a hurricane through it.
How do you feel about like colonics in general, like once a month, or like what are your thoughts on that?
Most GI docs, like the good ones that I know, they don't like it.
True.
Yeah, most don't like it because for most people the colonic will upset their flora. But I think I've heard of some people who've just had like lifelong issues with IBS and constipation and other things, and I think they're so messed up already that they're thrown off, and they're thrown off already, and the colonic tends to help them. So I don't know, but I guess I leave that up to the GI guys, because it's probably one of the hardest things other than like endocrine, you're trying to like deal with people's hormones and balance them. I think getting the gut
Yes.
flora calm is just as hard or harder. It's so difficult to do. That's why they're doing like fecal transplants. Like they take somebody's shit and they put it
I
up their
know. I've
ass.
I've heard.
Yeah, so it's
Oh my
it's
God.
a very difficult thing to do. So now that you're like stuck at home all the time, are
Yeah.
you well, I know you're vlogging, but like are you doing more at home type of like meditation, exercise, anything that you found to be like useful where it keeps you, there's a lot of anxiety in the world right now.
Yes.
So I find like
Including
there's a
my, I mean,
good,
everyone has it, myself included.
yeah, and you feel it. There's like a tension around, and New York for sure is worse than LA.
Yeah.
But on top of that, we're also stuck in the house, so people are getting angsty and want to like move around. Is there anything that you're doing stuck in the house for both meditating and exercising that you found is like nice, or do you have videos on it?
I know I've done a few random videos on it, but um keeping up with a workout once a day is just, it's never been more important. I think because we're inside, we're not like active, we're not mobile. So there's days when I just don't want to do it at all and I have to drag myself, but it's like as weird as or corny as it might sound, like as soon as you start moving, it's like the instant endorphin release and you just, it's like you feel your like your body in circulation and you just move, and like it's so important to me to do that. So I've been doing FaceTime workouts. So sometimes I think like if
FaceTime
you're
workout? Oh, you
alone,
mean like watching
no, like
the
I'll FaceTime my trainer and we'll do workouts together. And like I like having I mean having a trainer is such a privilege. I didn't have it for so long. And now the last 2 years I've like really relied on it. So it's much more helpful for me to do that. But even if my trainer's busy, like literally my one of my girlfriends, we're like gonna go on FaceTime and go for a walk, both of us like in different states, but just kind of having like that socialness to it, like
hmm
having someone, or even if you guys like go on FaceTime together and then like on your laptop do the same workout, but you're still like doing it together. There's just something about that motivation of it, especially when we're like so isolated. So that's been really nice. Um, I've really been trying to like realize that this next year or however, probably a year till we actually get back to complete normal
yeah.
is never something that most we're never going to experience, hopefully in another lifetime, or a time that we just will never get back. And as terrible and tragic as it is, like try to just find things that you're never going to get the opportunity to do again. Like if you're staying with your parents, like eating dinner with them,
Yeah.
if you can sleep an extra hour. Like I used to be a very rigid person when it came to schedule, where I would get really anxious if I woke up 15 minutes late, even if I'm working from home and I'm like, I missed my workout. Like I've got to be on a schedule. I'm not going to be productive. And now I'm just like trying to go easy on myself, I think in general, because there's so much unknown and uncertainty and anxiety, whether you lost a job or someone that lost a job or you're worried about your parents. Like everyone has so much anxiety. It's so important to just go easy on yourself and not like just give yourself a little break. So meditation's been huge. Working out every day has been huge. I've been dry brushing every morning before the shower. Doing a little wellness routine before I shower has been really nice. It just makes me feel good. So I dry brush, I put on a mask, I let it sit for 10 minutes, then I get in the shower and it just kind of starts my day right.
So what's funny is my shower has always been my like morning refresh, and I don't
Yep.
drink coffee. I can't drink coffee. I get like, I'm already too high energy. I get like cracked out. But my shower, I spend like an excessive amount of time in there, and I'm in a drought state, so I shouldn't be doing that. But I like spend so
I
much time
know.
in the shower because it's what like relaxes me and like wakes me up every day. And what's funny about all this is, and this is something that my friend told me. My friend goes to like these Tony Robbins seminars for motivation and things like that. And he's become very religious about it. And he tries to tell me, he's like, yeah, Ben, you should definitely like go to these things. They're great. I'm like, Bernardo, are you serious? Have you not seen my life? He's like, yeah, you're right. You need less motivation. You need to chill out. So I found that like the friends of mine who are generally more relaxed in their lives right now, they're getting bored. Whereas the people that are
Mm.
so hardcore, um, like they struggle a little bit because they can't be hardcore. And then all of a sudden now it becomes like, oh my God, I can't believe I was living like that. I can't believe I didn't do this sooner. And this whole next year, which you're right, it's going to take, a year for it probably to go
I
back to
hate to
normal.
say it, but like it is.
Yeah. Yeah. We're going to be wearing masks and contact precautions and all that. But I'm so happy it happened because my life was going like this. It was just like tanking in terms of just spending too much energy working and not enough time actually just sleeping and relaxing.
Like
And
in
like,
the rat race of like I've got to do more, I've got to be better, I've got to
yeah,
like compete. I totally
yeah,
get that.
yeah. I'm an obsessive person, and it could be anything. Like you could have me like making dolls, and I'll become like some kind of doll fanatic, and I have to just make as many creepy dolls as possible. It's like that's just how I go. And my mom, if she like hears this, she'll be so happy because I never listened to her. And she goes, "See, I told you, Benny, you need to relax." Because she's like, "Why are you flying somewhere this weekend?" I'm like, "I could sleep on the plane. It's 8 hours." It's
Oh yeah. You know what's so funny is like my mom and Persian parents like it was just all she wanted me to do was study in high school and like yelled at me to study. I didn't want to. And then as I've gotten older, she's like, "Don't work so much." I'm like, "You're the one who instilled this in me." Like this kind of like work ethic. So that's been nice. And honestly, I've traveled so much, and this has been like the least I've traveled in. I mean, I don't even know how long, and that's kind of been nice too to just like take a little break. It definitely like trust me, I would much rather things are, back to normal and we could go back to regular life, but we have to just assume that like we have to get a lesson out of it. So I think
Yeah.
like, the best thing to do is just to be easy on yourself, even if you're having a bad day. Like just it's understandable. Like there's so much uncertainty and it's scary. So that's a big part of wellness is like mentally being good to yourself. It's not just about like the superficial stuff.
Yeah.
Being fit and working out.
Yeah, and we see that like Spain has been doing it right all along. Take a lot of siestas and like enjoy family time. I used to live there.
Sleep is great for your skin too. So the more sleep, the better.
Yeah, 100%. So we're actually getting.
I used to demonize sleep so much. Like I was like, I have to work harder, and now I'm like, I want the beauty sleep.
No, me too. I like waking up at like 11 a.m. now. So I'm a 5 a.m. I wake up every single day. Now I wake up at 11. If I want to wake up at 9, I'll wake up at 9. It's fantastic.
Totally.
And I remember being in Spain, and Spain was like that when I lived there. When I visit Dubai is like that. Like patients won't show up to your office until like noon. Even if they have a night. Oh yeah. In Dubai, they wake up when they wake up. They have breakfast. Is that true? Yeah.
I love Dubai so much. I was just there in December. It's amazing.
Yeah, it's a different pace of life. And I think right now we got to like mimic it a little bit and appreciate it as much as possible.
Agree.
It's nice. But so we're getting up to an hour. Instagram's going to cut us off. But I really like fully would say for everybody who has time, your YouTube stuff and your Instagram is like an encyclopedia. And it's a very trustworthy one where there's like zero bullshit about stuff. And even the things that you'll say, you're very impartial. You'll say like, okay, well, I'm doing a vegan diet, but don't worry, you can do this, you can do that. You're not like my way is the right way. You're very conscious of, that's why I think
thank you so much for saying that. That means a lot.
Yeah, no, I'm telling you, I get bored on people's Instagrams. I was going through everything. I'm like, dude, this is fucking good. Dude, this is good. And then
that's amazing. I love that.
Yeah, and you got the Instagram TV ones. They're very professionally done. They're very nice.
Yeah, we'll see how they are now with no videographer, but we'll
yeah. So we'll give everybody homework. So everybody, go look at our YouTube and watch it like an encyclopedia. Go look at. There's so much information there, which is great. So, all right, I'll let you go. If you get bored, let me know. I'm out here.
Enjoy it, please. West Coast is amazing. We'll definitely I'll save this live too, and we can post parts of it.
Awesome. I'll send it to you.
Okay.
All right. Thank you so much. Yeah, you too. Take care. Bye, everyone.